Hi, today we're going to be talking about carpal tunnel syndrome. What is carpal tunnel syndrome? The symptoms, the diagnosis, and the treatment. So the carpal tunnel is a tunnel that connects these two bones, the radius and the ulna, with a tendon. And you have the median nerve and other tendons that go through the carpal tunnel and supplies the hand. So the median nerve supplies these three fingers and half of this finger. It supplies the skin, so it gives a sensation of these fingers and half of this finger, and it supplies some of the muscles, the lumbricals, that allows for the movement of those fingers. So with carpal tunnel syndrome, essentially you have compression of the median nerve. Why does it happen? Typically it's mechanical. So people who use their hands and they bend their wrist, they compress the nerve. Typically when we sleep and we bend our wrist, and that movement compresses the nerve. People who work on the computer, people who use their wrist as mechanics, electricians, plumbers, any movement of the wrist or bending the wrist will increase the risk of compressing the carpal tunnel and compressing the median nerve. Now also certain people with chronic disorders, especially diabetics, especially people with thyroid problem or rheumatoid arthritis problem, are at a higher risk of compressing the median nerve or having carpal tunnel syndrome. Now we talk about the symptoms. Typically the symptoms, depending on the severity of the compression, it could be mild, moderate, or severe. So the symptoms usually begin with numbness and tingling sensation of those three fingers. Burning sensation typically occur at night time, in the middle of the night or early in the morning. The patient wakes up with numbness and tingling, swelling, or the feeling of a swelling of the fingers. They usually feel the urge to shake their hands off to relieve the symptoms. The symptoms are worse at night time, early in the morning. However, they can happen during the day if the patient uses or bend their wrist. Now, the symptoms can progress to become weakness of those fingers. Grasping with these two fingers become weak. Now, the diagnosis is based on the clinical history. When the patient comes to us, we take the clinical history of having numbness and tingling sensation of those three fingers, a lot worse at night time. Then we go to the physical examination. We compress the carpal tunnel, and that will aggravate the symptoms and make the symptoms worse. And we also tap on the tunnel itself, and that can produce the symptoms. If the patient they can have decreased pinprick, light touch on those fingers. We can differentiate between the sensation on this side of the fourth finger or this side. If the patient has weakness, they will have weakness in grasping. So typically if they do this movement, they cannot hold the finger inside and they release because of the weakness. Now, to confirm the diagnosis, we do a nerve conduction test and an EMG or electromyography. The nerve conduction test has two parts. It has the nerve conduction, which is we test the nerve itself. We stimulate the median nerve and the ulnar nerve. And typically we do a motor stimulation, so we check for the motor function, which is the weakness, and we check for the sensory function, which is the sensation. We compare the sensation of the median nerve and the ulnar nerve and the radial nerve. This will give us the severity of the carpal tunnel compression. We also do the EMG, especially this muscle, so we can see if the nerve is actively compressed and causing what we call denervation of the muscle. With the nerve conduction test, we give the severity of the compression of the median nerve. So if it's mild, moderate, or severe, based on that, we recommend treatment. Now we talk about the treatment. The treatment depending on the severity of the symptoms and the severity of the compression based on the nerve conduction test. However, if the compression is mild to moderate, then we start with conservative therapy. Conservative therapy includes wrist splint. The wrist splint could cure the problem. Wrist splint usually has a metal in the splint itself to prevent the wrist from bending it. Especially we wear it at night time because it can interfere with our work during the day. So most importantly, to wear it at night time. If we prevent this movement, which is compressing with the median nerve, then the nerve itself will heal itself. Now, if the patient has severe symptoms, we can also inject the carpal tunnel. We inject it either with the steroids and anesthetics or platelet-rich plasma and anesthetics. However, if we inject, we still need to use the splint because we have to maintain the wrist in this position to allow the nerve to heal itself. If the patient has severe carpal tunnel syndrome, severe compression of the median nerve on the nerve conduction test, if the patient has weakness of the muscle, then we got to a point that we have to go to surgical intervention, which what we call carpal tunnel release. A simple procedure that usually done as an outpatient where the surgeon will clip and cut this tendon and therefore releases the nerve and releases the pressure off the nerve. And typically we reserve this in two situations: if the compression is very severe, or if the on nerve conduction test, or if the patient has weakness. At that point we have to go to surgery. Other than that, we use conservative therapy, and typically it is very successful. And we can use conservative therapy up to 12 months before we go to surgery. So the bottom line, if you have carpal tunnel, if you have the signs and symptoms of carpal tunnel, it is important to diagnose it and treat it early on, because you do not want to wait. It will progress to become severe and cause weakness. When it becomes severe and cause weakness, the only solution is surgery. And even if you do surgery and you have weakness, it might be irreversible. So diagnosing it and treating it early on is a lot better for the patient. Thank you.